Hi everyone, my name is Chauncey Carroll and I'm a leadership and public health practice student, and my case study was the 2013 Boston Marathon bombing. So a little bit about the event. The Boston Marathon is one of the most iconic and popular races, and it occurs on Patriots Day. There are 27,000 runners, over 500,000 spectators almost every year, and it starts in the rural New England town of Hopkinton, travels through 7 cities and towns along the route, and ends at Copley Square in the heart of Boston. On April 15th, 2013, at 2:49 p.m., 4 hours into the race with thousands of runners still on the course, 2 pressure cooker bombs dispersed in the crowd exploded within 10 seconds of each other at 100 and 200 yards from the finish line. There were 3 immediate casualties, all spectators, and there were over 280 people wounded. There were no additional casualties at the hospital. 264 patients were treated at 26 hospitals, 75 patients were admitted, 54 underwent emergency surgery, and 12 required a lower extremity amputation. There was a historic manhunt and lockdown following the bombing, and over 1,000 federal, state, and local law enforcement officials identified 2 suspects who were brothers. This widespread lockdown ended up in the police being able to capture one of the brothers, while the alleged mastermind of the attack died following a shootout with law enforcement. So, being a huge global event, there are many key players and participants in this attack that were actually set up pre-race. So it's a multi-agency, multidisciplinary process every year for planning this race. It includes representatives from multiple agencies, which you can see some of those in the table on your right. The Boston Athletic Association is actually the leader to bring all of these agencies together year-round. And a lot of this includes, during the race, a multi-agency coordinating center, a lot of emergency operations centers staged in each city and town along the route. And a lot of this support system includes 8,500 volunteers. So 2,000 of those are medical volunteers. There are 26 medical tents along the route, so 1 at each mile, and then 2 large tents at the finish line. So post-bombing, a lot of these were then activated. There was initial response from bystanders, from first responders, from volunteer medical providers. A lot of the injuries were spectators, and those hospital incident commanders were already set up and then quite extra activated at those respective sites. And then they also helped to evacuate the surrounding areas because that was just massive chaos, as you can imagine. But they did end up centralizing that unified incident command, and there were major players included from local, state, and federal agencies, everything from law enforcement and transportation to public health as well. So diving into the public health role a little bit more, unlike most health departments, the Boston Public Health Commission operates emergency medical services. They are a regular responder for the race and have responsibilities and activated the Office of Public Health Preparedness and Medical Reserve Corps. So they already had 200 personnel on site that were ready to treat runners. And the local community communication hub is the health department's medical intelligence center. Within 3 minutes, they had notified all the hospital emergency departments to prepare for the medical surge, and they worked to determine where those patients were sent so they could connect them with family and friends. The state health department was the primary coordinator for mutual aid, so they helped to obtain blood supplies from nearby states and help hospitals locate surgical and amputation kits. And they also helped sift through hundreds of offers for assistance and donations from the community. State and local health officials stayed in contact with the hospital systems with the Health and Homeland Alert Network, which is a secure web portal that sends out real-time alerts. Another major role for the public health department was mental health and psychological first aid. They, within 5 hours, they had set up drop-in counseling centers all around the city, and family reunification centers and assistance centers for stranded runners. They then began the difficult job of making sure that all bombing survivors, regardless of visible injuries, were connected to care and support. A lot of runners were from out of town, and so those state workers contacted the fellow health departments to identify mental health services for them back home. In the days and weeks that followed, the health department deployed counselors across the city to schools, community groups, and they met with first responders and attended and hosted vigils. In terms of response assessment, it's overall considered an extremely successful integrated response. The astoundingly high survival rate, despite the nature and the severity of the injuries, is attributed to a lot of that preparedness that the Boston Athletic Association, Boston EMS, and Boston community at large had really planned and drilled for those mass casualty events. In preparation for the race, that medical tent at the finish line had the capacity to provide for 2,500 runners, and the Boston EMS crews were already staged and ready to take up to 250 runners that might need more medical attention. So this provided a bulk of the capacity to transport victims to the ED. So from scene departure to the emergency department averaged only 11 minutes, with the site completely cleared within 22 minutes. And hospitals were ready for that patient surge with 10-minute notice because of all those communication. However, there was a lack of a joint information center, and this caused a big headache. Public safety officers did not coordinate or control messaging, so there was often conflicting information. And then also with mass communication traffic that increased after the attack, a lot of responders ran into jammed communication lines, or when the FBI later asked the public to send in all their videos and photos of finish line, that massive data upload was very slow and it crashed very often. So there were several intentional factors that contributed to the lower mortality, but some luck as well. So as I stated earlier, there was a formal preparation and recognition of it as a global event and potential desirable target for attack. So there were already those hospital incident commands up and running. That Health and Homeland Alert Network was utilized very quickly. Within 1 minute of the bomb exploding, a worker in the medical tent alerted the Emergency Operations Center, and which that allowed the state health department to send out that alert to all those hospital emergency departments via that network within minutes. And the overall distribution of patients to trauma centers was pretty equal. So EMS paid attention to the distribution of patients deployed from the scene, and that helped maintain that smooth functioning of the trauma centers. However, on the side of luck, timing could not have been more favorable. So the state holiday meant fewer elective surgeries and more open ORs. Traffic was slower, and some of the roads were blocked for the race, so that allowed a really fast transportation of victims. And then the blast occurred at 2:49 p.m. and shift changes at 3 p.m. So hospital leaders were easily able to ask their staff to stay on site, and they were able to double their staff within minutes. There are also 6 level 1 trauma centers, only 1 mile away from the finish line. So had the bombs happened at the starting line in the rural town 26 miles away, the outcome could have been much different. And then the bombs were placed on the ground. So the blast pattern was mostly injuries to lower extremities, and saved some potential lives just since it wasn't higher up and targeting more heart or brain injuries. So within hours after the bombing, the slogan "Boston Strong" emerged as a viral hashtag on Twitter, and it rapidly spread around the world. So Boston Strong really communicates that pride and inspiration from that dedicated response. Not only the first responders, but the community at large was a huge player in capturing the suspects. So everyone felt really involved in that. It was really their fight together. And it's that forward-looking belief that their community will come back stronger than ever. So it really captures that preparedness and resilience. And there was a lot of increased federal funding and for emergency preparation after 9/11, with the requirement that a lot of this be drilled at the regional scale. So that developed closer institutional relationships where a lot of those agencies developed trust and mutual respect and an understanding of how to best collaborate across their departments. There was also that large immediate community response. So people helped random stranded runners. They provided, those key videos and photos of the finish line, and that high compliance and acceptance of the shelter in place with the manhunt was unprecedented. And then prior to the bombing, Boston had actually started integrating emergency preparedness and community building with a neighborhood response team. So this included people like clergy members, social workers, public safety responders, and they were recruited to join those trauma response teams. And this provided an incredible structure for response and recovery following the bombing. So some lessons learned from the event. There was definitely a strong shift in implementing more stringent risk screening procedures and security just to manage risks at large events. So this thing includes things like carrying belongings in clear bags now, or not even being able to bring a backpack into an event. And then, as said before, if the bombs had been at the finish line, or at the starting line, mortality could have been much higher. So organizers now deploy mobile medical teams as well as security teams that can move along the route as runners progress. And then while Boston was relatively prepared in the immediate response, they definitely learned that those plans need to include long-term recovery. So building that infrastructure to recover is just as important in planning as the initial catastrophic event. And so it's never too early to begin building community resilience. And then the incident command did not have the depth of leadership it needed for the extended response. A lot of people were up for over 36 hours, and that was both the main leader and their deputy, so there was no rested capacity in the system. So this inevitably degrades judgment and performance of even normal tasks, so they need to be able to rotate personnel more often. And then technology was identified as a huge priority to be able to develop and utilize for effective communication. So to solve those jammed communication lines and data crashes, FirstNet emerged as a Congress-enacted nationwide broadband wireless network, and it's dedicated to public safety. So it was adopted in 2018 nationwide and used at the 2018 Boston Marathon. And it just allows first responders to have increased connectivity and capacity despite an increased network traffic that just happens naturally at big events. It also includes some cool tracking software to locate personnel and resources quickly to be able to dispatch them to an incident. So these are all of my references. Hopefully you learned something and were inspired by the Boston Strong mentality. Thank you so much for listening.